Next topic is to retain cup. So shoulder pain, treat with local points such as LI15, triple Wermer 14, GB21, and other ASHI points and distal points. Add influential points for muscle and tendon, GB34, and influential point for bone, UB11. Leave all needles for 20 minutes. Remove the local needles only after 15 minutes and place 2 to 3 cups on the pain area. These cups and the rest of the needles may be removed after another 10 minutes. This is an excellent in bursitis and pressure pains when the patient cannot lie on the painful shoulder. Sa backache naman, after local needling, 2 to 4 cups may be placed for 10 minutes on the painful area. This is an improvement in the range of movements immediately after treatment. And you will see that the patients can put on their socks and shoes much more easily than before the treatment. Cupping is especially suitable in pains which occur when starting to move after rest, with stiffness and reduced mobility, and which take a long time, 2 to 3 hours after getting up from sleep to improve. Next, osteoarthritis of the hip joint. This is treated locally with either hot needles or electrical stimulation of needles, depending on whether it is a cold or hot pain. At the end of needling, 4 large cuffs may be placed around the hip joint and removed after 10 minutes. This increases the mobility of the joint. Cupping in edema and damp stagnation in organs. Cupping works well on an area with cold edema. In the treatment of osteoarthritis of knee, there is often some edema around the knee. Cupping may be used in these areas and is very effective. In damp conditions of internal organs, especially in cases where the elimination or circulation of fluid is poor, cupping on the back shoe points of the organ will be helpful. Examples: cuff with excessive phlegm, chronic bronchitis or asthma, cuff UB13, back shoe points of the lung, peripheral edema, cupping of UB20, back shoe point of the spleen, oliguria with water retention in chronic pyelonephritis, UB23, back shoe point of kidney, urine retention in bladder instability, cup UB28, back shoe of urinary bladder. Cupping is also very effective in the management of ascites or lymphedema in any area of the body. 2 points should be used simultaneously for this, REN 5 and REN 9. These points are needled for 10 minutes. And when these are removed, the cups can be applied for another 10 minutes. Since cupping is usually performed using fire to create a vacuum, it often leaves a bruise that takes a few days to disappear. If the patient wishes to avoid having bruises, then intermittent cupping should be applied. This is a method where the cup is applied and removed immediately, making a popping sound several times till the affected area is quite red and warm.